Tembisa Hospital CEO has been suspended following a report into the death of Shonisani Lethole at the facility. Lethole died at Tembisa Tertiary Hospital last June. The Health Ombudsman's report into the matter revealed, among other things, that he wasn't fed for over 100 hours. eNCA reporter Masego Rahlaga is following that story for us and joins me now live. Masego, there is also a group that helped the family advocate for justice for Shonisani. What are they saying about the hospital CEO's suspension?
Well, Anli, you'd remember that on Tuesday, after the Health Ombudsman, Professor Malakapuru Makgoba, released his report into what happened to Shonisani Lethole, the following day, the banner Justice for Shoni actually had, they held a media briefing, a virtual media briefing with other families, actually about 6 other families that came forward to tell horrific stories. For instance, I remember 2 particular stories. The first is of a 19-year-old whose mother was admitted around the same time as Shonisani at the facility. She was put into a COVID-19 ward the same way as Shonisani before the health officials had even confirmed that she was COVID positive. They had already put her in a COVID-19 ward. And what was worse in that case is how strikingly similar it was to what happened with some of the cases at Life Esitimeni, where the family was only told 4 days later, when they went physically to the hospital to find out why they couldn't get a hold of their mother on her cell phone, and they told the family that they had forgotten to let them know that actually 4 days prior to their visit, the mother had passed away. Another one that resonated with the report by the Health Ombudsman is about how the files are kept at that hospital. A woman who was carrying twins lost one of her babies because she had to give birth while sitting on a bench because the hospital lost her file and couldn't confirm whether she had an appointment for a cesarean section. But here is that campaign member, Bori Lagrange, on what they think about the suspension.
From the outset, we understood that justice for Shoni is also justice for many, many other people. And so over the last 7 months or so, since starting this work to push for this change at Tembisa Hospital, we've been approached by many other families, the Singwayo family, the Ngube family, the Mguni family, the Swatboy family, the Twala family. They've all in some way suffered a loss or received substandard care at this hospital. So clearly it isn't just about the death of our friend under those horrific circumstances, but it's essentially about a community. Over 800,000 people depend on Tembisa Hospital for professional and adequate care. And it's clear from the Health Ombudsman's report that that's not what people are getting.
I can only imagine it's been a very, very difficult time for Shonisani's family. Given the suspension of the hospital CEO, do they feel that justice has to some extent been served?
I did ask Shonisani's mother, Patricia Lethole, that question, Anli, this morning, and she said that it did give them some closure, although not completely, because she says that their fight is still far from over. She says for her, it's more about actually making sure that eventually the Tembisa Hospital is the kind of hospital that will serve the people who need the help better. Now, the Tembisa Hospital, Anli, what's important is that it's a tertiary hospital, which means it actually has specialized care. It was named by the former Gauteng Health MEC, Dr. Bandile Masugu, as one of the hospitals where patients who display COVID-19 symptoms would be referred to from the local clinics around the East Rand. So it's not a small hospital we're talking about. It's a 24-hour tertiary hospital that is supposed to have special care and that is supposed to give the kind of care that a huge hospital like the Chris Hani Baragwanath Hospital can also offer. So that was one of the main concerns from the Health Ombudsman as well. And the family also saying the lies that were told, the withholding of information, the falsifying of documents by some of these healthcare professionals at the hospital was one of the things that gave them a nightmare. But I also asked them if they thought criminal charges should be instituted against the health officials, and this is what Shonisani's mother, Patricia Lethole, had to say about that.
Really, they are dangerous. This is very dangerous for people to tell lies. Remember, they are dealing with human beings who are in a very weaker position. And those people are the ones who must uphold the truth. And as a family, we have not yet sort of whether it needs to be a criminal charge or whatever. But to me, they are in the wrong place. And again, having said that, truth needs to be upholded. So what do we do to a person who is telling the truth? Can we punish a person by telling the truth or what? Whatever happened, but for them to say that when you are a doctor, I am not a doctor, I'm an educationist, to tell a lie when you are under pressure, I don't think you need to be handling people, really, human beings who are in the weaker position. And I'm afraid that the hospital is where people need your help. Don't see them as statistics. See them as people, as human beings, as your son, as your daughters, as your mothers. If what you have said, you cannot do it to your son or your daughter or whatever, you are in the wrong place, my brother. With that one, I'm not God, but what I'm saying is that there are some sins which are very much unforgivable because you are holding a nation at ransom. We cannot trust you as a doctor, but we are coming to you to help us.
Thank you very much. That was reporter eNCA's Masego Rahlaga.